At Myeloma Patients Europe, we are supporting around 50 organizations supporting AL amyloidosis and myeloma patients in Europe, and to better determine where our best efforts should be focused and understand the unmet needs in the field, we have decided to conduct an international survey on quality of life of AL amyloidosis patients around their diagnosis experience and their experiences with treatment. So we collected 24 answers, and of those 24 responses, 19 joined follow-up focus group discussions, during which we've discussed their experience during diagnosis, the impact of the disease on their quality of life, and the experiences with treatment. So from the survey results and the focus group discussion results, they shared with us a lot of different emotions, with the diagnosis being horrifying news or being devastating, or sometimes it's a relief because if they had a long time presenting symptoms before the diagnosis, it's actually a relief to know what it is. Regarding the time that it took for them to get a diagnosis, it really varies depending on the patients and where they live. So of course, people who were treated in excellence centers had a much faster diagnosis. Of course, those patients share with us that they are always looking for the best specialists in their field for their treatment. So in terms of their quality of life impact of the disease, they shared with us a lot of difficulties. So for example, the lack of information around their treatment options or clinical trial options, but also the lack of information around side effects, the lack of access to psychological supports, but also the lack of information on clinical trials. So they really also mention how limiting is the disease for them. So the limitations can have various impacts on their lives. So they can be limited in the time they can spend with friends. They can be limited in what they can do, what they cannot do, but also having a physical limitation. So not being able to do exercise or to walk. So I think we had around 47% of the patients participating in the interviews, telling us that they are not able to do all the things they want to do. And then we had around 16% who were saying they are not able to do most of the things they want to do, but still spending less than half a day in a bed or a chair, and 5% who were not able to do most of the things they want to do and spending more than half a day in a bed or a chair. So those are really unmet needs that need to be addressed, and it has also impacts on their professional life because some had to stop working, some had to reduce their hours, some had to switch to a less physically demanding jobs, and some had to retire early. So it really has a lot of impacts on their life. Their ability to go on with their life, take care of children and other things. So the side effects that came back the most during the discussions with patients and that they're experiencing with their current treatments were fatigue, tiredness and weakness, but also they mentioned loss or change of taste, neuropathy and tingling of the feet or the hands, other side effects. In terms of what is really important for them to when deciding to go on with the treatments, they report for them being very important to consider nausea and GI distress, but also the impact it will have on their mental health. So I think headaches and mental health came back, and also loss of hair and skin issues or itching. So this was really important. But from the discussions we had, they are pretty much willing to accept any side effects if those are temporary and if this preserves their quality of life and the things they can do, and especially their mobility. So I think to conclude, our call of actions following the results of this study is to recommend patient organizations, but also other stakeholders involved in the field, to take the following actions. The number one is to continue raising awareness around amyloidosis to make sure that all patients have a timely diagnosis, because this is key for the rest of their treatment journey and for their outcomes. The number two is to establish core educational resources for our patients, but also for healthcare professionals. Number three is to establish peer support programs, because during the discussions, patients said how important it was for them to have access to patient groups, to meet people who can support them and who have faced the same issues they are facing and who can understand what they are going through. Number four is to inform about clinical trials, and to answer that need at Myeloma Patients Europe, we developed an online clinical trial search tool to help myeloma and AL amyloidosis patients to find clinical trials and engage discussions around clinical trial options with patients. And the last action item would be to advocate for integrated care approaches and make sure that different healthcare teams coordinate their efforts, because AL amyloidosis patients are treated by different specialists, sometimes in different facilities, so they reported having a big need in a better communication between those healthcare professionals. So so there are still unmet needs for AL amyloidosis patients, and they really value their quality of life, and this means being able to spend time with friends and families, continue having hobbies, and being able to do the things they like to do. So in other words, having the life they had before diagnosis back. So, and we hope that those results will help us defining the directions that we should take as a patient organizations to help our community and focus our efforts on the topics that are the most needed. You can find the full report with the findings of this study on mpeeurope.org, where you can also find our different educational resources on AL amyloidosis.